in highlighting mission and vision, instilling excellence in electrical profession, having a dynamic.
Hello everyone. Once again, this is Professor Roger Flores, an Associate Professor of Central Mindanao University. Once again, we'll discuss, to continue our discussion with this Chapter 7 of our subject is 73, Basic Occupational Safety and Health. This Chapter 7 will be our last chapter of the subject, which is entitled Basic First Aid. Here, we're going to discuss the most basic information and what to do when it comes to the accidents or whatever incidents that might happen in our daily job or in our daily work. Okay, so to begin our discussion with this Chapter 7, we have here the basic first aid. Here we are going to discuss what will be done if something will happen in our workplaces or even anywhere in our daily routine, in our daily lives. So we have here chain of survival. Okay, so we have this, in order for a person to survive, then we have this chain of survival or the sequence that you are going to do in to apply first aid. Okay, so first we have early call medical assistance. Okay, so we are not expert to this field because we are an engineer. So we are not medical practitioner. So that is why we have the first thing that we are going to do if there is an accident or incident that will happen. So what we are going to do first is we must have to call for medical assistance. Okay, so that is why it is understood that as much as possible we should have number, or a call number or a telephone number for example, for rescue, for a hospital number. Okay, so that we will be immediately attended, or we will be able to call medical assistance. Then the second part is this. Okay, we have this early first aid cardiopulmonary resuscitation, So it will be done by us. Okay, depende po sa the situation of our of the victim, then we should have to apply first aid, or CPR. That is cardiopulmonary resuscitation if the victim is unconscious. Okay, so next that we are going to do is early defibrillation in a chain. If it is necessary, and if you observe that the victim is not or there is a hardship in breathing, then try to apply defibrillation. Okay, then the last part here for chain of survival is this early advanced care in the hospital. Okay, so considering that we have the rescue, then our patient or the victim is already brought to the hospital. So then we should have to have an advanced care, in the hospital, advanced care, and then it will be happened in the hospital. Okay. So next, what is first aid, by the way, So it is the immediate care, okay, immediate care given to an injured or suddenly ill person. Okay, meaning to say that it is not it is not it does not happen, or it doesn't happen in the given situation, or it happened in a given situation where you did not expect that it really happened, no? So when we say does not, and it does not take the place of proper medical treatment, so in other words, it happened anywhere, which it is not it does not happen in a hospital or any place where there is a medical treatment. So that is where we are going to apply the first aid. Okay. So legal considerations. So of course we should have to consider legal impediments if there is any. So this means implied consent involves an unresponsive victim in a life-threatening condition. So of course, if the victim or the patient is responsive, then we should have to ask for a consent of the victim. But if it is not unresponsive, then of course it is understood that we should have to apply directly or immediately the first aid. It is assumed or implied that an unresponsive victim would consent to life-saving help. No, life-saving help. Okay, it is said here that only perform first aid assistance for which you have been trained. Okay, so if you are not trained to do this first aid, then do not do it, because you might be able to severe you might be able to the victim might experience more severe effect to these accidents, no? So if you are not so sure of what you are doing because you are not trained to do first aid, then do not do it. Let experts to do this first aid. We have to do first this Shen survey. What is this Shen survey all about? No, when confronted with an accident or illness on duty, it is important to assess the situation to determine what kind of emergency situation. So in other words, the Shen survey is just for assessment of the situation. Okay, so that we will be able to determine the degree of emergency. Okay, so that we are going to deal with. No, so this is for the safety, the victim's safety, and that of other person. Okay, so if it is necessary to perform first aid, then do a quick survey of that Shen that includes looking for three elements. So look for these three elements. Okay, so first, hazards that could be dangerous to you, the victim, or bystanders. No? So try to evaluate the degree of the hazards or hazardness. Okay, if it is not hazardous, then do the first aid. No, so when we see hazards, it might affect the situation of the victim, and of course to you as the rescuer, and of course the other people around. No, so try to determine this or assess the situation. Then number two, the cause of the injury or illness. So when we say cause or mechanism, how it happened. Okay, so try to evaluate, try to determine, try to ask. Okay, so how it happened, no? So to the victim or to the patient. Okay, number three, the number of victims. Okay, So does it single or single accident or single person or victim or several victims or several persons involved in that accident. Okay, so this survey should only take a few seconds, no? So in other words, try to do this survey as fast as we can, so that if the victim needs immediate help, then we will be able to do this first aid. Okay, so try to uh, make this scene survey as fast as we can. Okay, so next thing that you're going to do is try to have this initial assessment. Okay, so we have this initial assessment. Okay, our goal here for this initial assessment is to have visually determine whether there are life-threatening or other serious problems that require quick care. Okay, so that is the purpose or the goal of this initial assessment. Okay, so like for example, breathing. If the victim is still or has or hardship in breathing, or does it bleed, okay, or uh, shock, no? Okay, so that is the first that you are going to do to determine if there is still if he or she is still breathing, nagbi-bleed or na-shock, no? And then try to determine also the if there is what is the cause, no? If the cause is burning or burns, choking, na choke, that the victim felt very hard in or experienced very hard in breathing, then also heart attack, no, or maybe the cause of your the accident, no, or any fracture. Okay, so that is the initial assessment that we're going to perform or to do. Then determine if victim is conscious, no, by tap and shout. Okay, so most of the rescuer will try to call the name. Okay, if you do not know the name yet, then try to of course shout if asking for his name, what happened, no? So if the victim will answer, meaning to say that he is conscious or he or she is conscious, no? So next that you are going to do is check the for ABC, no? So we call this one as ABC. So A is for airway. Okay, so try to check if the airway is open. Then the letter B, try to check if or assess if the victim is still breathing, or try to check if this victim has its still circulation. So when we say circulation, we have to try to check for signs of circulations, no? Or for breathing, try to look, listen, and feel the victim. Then talking about airway opening of the airway, then try to tilt the head and then lift the chain, no? So tilt the head and then lift the chain. Okay, so we have a note here that this step-by-step initial assessment should not be changed. Okay, it takes less than a minute to complete unless first aid is required at any point. Okay, so less than a minute, try to check, no? Try to check the airway, the breathing, and the circulation. Okay, so try to assess also the components, no? So we have this assessment sequence component. If the victim is responsive, so as we said, try to tap the shoulder or any part of the body which is not affected by or any injury, no. So if or shout and call his name or anything, ask something if the victim is still responsive or responsive to your question, no. So ask them what injuries are or difficulties they are experiencing. Okay, so that is something that you're going to ask if the victim is still responsive, no? So, what happened? Okay, ask him or her. Okay, or maybe do you have any painful part of your body? Can you still move any part of the body, no? Check and provide first aid for these complaints as well as others that may be involved. Okay, so if he or she is complaining for any part of his body, then try to do first aid if it is necessary to this part. Okay, next. Okay, observe for obvious, no, if signs of injury or illness. Okay, check from head to toe. So meaning to say that, for example, if the victim is not responsive, then next thing that we're going to do is try to observe if there is a sign of injury, there is a sign of illness, no? And then try to check from head and towards the toe. Okay, provide first aid if it is necessary or cardiopulmonary resuscitation if it is if the victim is unconscious, no? Or if you observe that there is an injury or illness, no. So as much as possible, if it is not necessary, then just first aid, and if it is necessary to perform CPR, then perform CPR. Take note that in performing CPR, then you must have to do according to what is suggested in performing CPR. It is not just as simple as pressing the abdomen of the victim. Okay, so next is we have to discuss if you observe that there is bleeding. Now, what you are going to do if there is bleeding, no, in any part of the body. Okay. So we have these control methods for external bleeding. So, for example, if the bleeding is or happened in an external part of the body of the victim, then we have to do these things. No, direct pressure stops most bleeding. So press, no, apply pressure to the part that bleeds, no. So of course, in doing this, wear medical. So we have this one, no. Wear medical gloves, no. So medical gloves. So if possible, if you have these medical gloves, no. So place a sterile gauze pad or a clean cloth over wound. Okay, so do not just press directly the open wound, but try to use a sterile gauze. Otherwise, you will be able to transfer virus or germs from your hand to the open wound of the victim. Okay, so elevate injured part to help reduce blood flow. So, for example, if the bleeding happens in the hand, then try to elevate this hand. Okay, so that the blood flow will reduce, no. Combined with okay, so we have that illustration above, no. So combined with direct pressure over the wound, this will allow you to attend to their injuries or victims. Okay, so direct pressure over the wound so that the bleeding will stop or else it will be minimized. Okay, so if bleeding continues, Okay, apply pressure at the pressure point to slow blood flow. So we have to determine or familiarize the pressure point in any part of the body. Okay, so what we call this one, just familiarize the location of this pressure point, no? So we have this what we call as brachial or femoral sites, no, of this pressure point. So when we say brachial, it is top of elbow. So we have this top of the elbow, no? Then we have femoral inside upper thigh. Okay, so at your knee, no? So above, no? That is femoral sites. Okay. So try to determine also the signs of internal bleeding. So if we have this, if the bleeding happens internally, no? So within our body, so try to determine bruises or contusions of the skin. So try to check if there is bruises, okay? So or contusions because it will change the color of your skin or the skin of the victim. So try to look for any part of the body that the color really changes. Now it will become more darker or something like a violet color. No, okay. Or any painful, tender, rigid breast, abdomen. Okay, so painful, tender, rigid, or breast abdomen. So any a part in the abdomen. Then try to check also if the victim is vomiting or coughing up blood. Okay, so for example, if the victim is vomiting of blood, so in other words, there is really an internal bleeding inside. Okay, so or cough, coughing with blood, no. So most of the time, blood will come out in any opening, so in our mouth, in our nose, so or in our ears, no. Okay, so that those are the common passage of the bleeding inside in our body or internal bleeding. Okay. So stools that are black or contain bright red blood. Okay. So we have that one, no? Then try to what to do for severe internal bleeding. So what we're going to do if you observe that there is a severe internal bleeding. So again, try to monitor EBC, the airway, the breathing, and circulations. So keep the victim lying on his or her left side. So in other words, let this victim lie down and left side position, no, left side position. So that is the position. This will help prevent expulsion of vomit from stomach, or if he or she is vomiting, no, or allow the vomit to drain, and also prevent the victim from inhaling vomit. So if the victim is vomiting, so we should have to allow vomit to drain, and by positioning to left side, lying left side of on left side of the victim, you will be able to prevent the victim from inhaling his or her vomit. So treat for shock by raising the victim's legs 8 feet to 12 feet. Okay, and of course, do not forget to seek immediate medical attention. Okay, so let's continue to this shock. No, what is shock? So shock refers to circulatory system failure that happens when insufficient amounts of oxygenated blood is provided for every body part. Okay, so shock will happen, no, if there is an insufficient or deficiency of circulating blood, and of course it should be oxygenated, meaning it must have a sufficient oxygen with that within or with that blood, no. Okay, so this may result from loss of blood due to uncontrolled bleeding or other circulatory system problem. Okay, loss of fluid due to dehydration or excessive sweating. Okay, so of course, maybe trauma due to injury or occurrence of an extreme emotional event. So that is why if this person experience all these things here, he or she might experience shock and might lose his consciousness. No. Okay, so what to look for? So try to look for altered mental status or maybe anxiety and restlessness. So try to check if he or she is not pale or cold or clumsy skin, okay, or lips and nail beads, no. So check also the nausea if he felt nausea and or vomiting or rapid breathing and pulse. Okay, so fast breathing or pulse or unresponsive when shock is severe. Next thing to do is after first treating life-threatening injuries such as breathing or bleeding, the following procedure shall be performed. So lay the victim on his or her back. Raise the victim's leg 8 inches to 12 inches. Then to allow the blood to drain from the legs back to the heart. Okay, so that is the purpose why we are going to raise the leg or the legs of the victim. No? So prevent body heat loss by putting blankets. Okay, so as much as possible, put a blanket or a coat, no, under and over the victim. So under or over the victim. Try to put a blanket or try to put a coat if there is no available blanket. Okay, so next, okay, let's discuss these burns. No? Okay, so burns have been described as follows. We have the first degree burns, we have the second degree burns, and we have also the third degree burns. Okay, so for the first degree burn, it is just superficial, no? As we said, only the skin's outer layer is damaged. Okay, or we call this outer layer as epidermis, no? So at the skin, no? So for example, this part here, superficial part of the skin. Okay, so symptoms includes redness, mild swelling, and then tenderness and pain. So that is for the first degree burns, no? Usually heals without scaring, no? So it will just heal, no? Without anything to be applied, no? Okay, so what you're going to do, immerse in cold water in 10 to 45 minutes for or use cold with cloths, no. So try to use cold water. Try to immerse the portion that have been burned, no. Then cold stops burn progression if you are going to use this cold water. Then or may use other liquids as much as possible that will felt cold feeling of this portion, the burned portion. Or you can use aloe or moisturizer lotion. Now, next is this second degree burns and partial thickness only. So the upper epidermis or the outer layer and the upper regions of dermis are damaged. So as you can see here in the picture, no. So symptoms include blisters, swelling, sweepings of fluids, and severe pain. So when we say blisters, we have this one, no? We have the blistered part, and then the swelling, and then the whipping of fluids in any, if any, and then severe pain at that portion. Then what to do? We have the immersed in cold water again, or use wet pack, aspirin or ibuprofen. Okay. So if the victim can still drink oral medicine, then try to let him or her drink aspirin or inaspirin or any ibuprofen medicine, no? Or but do not break blisters, no? So that is because it might open the burned part, and then that will be it might be the entry of any infections later, no? So do not break the blisters. May seek medical attention again. Okay, so next is this third degree burns. Okay, so full thickness of the part of the body, which is the site of the burns, no? So severe burns that penetrate all the skin layers into the underlying fat and muscles. Okay, so it is shown here in this part here of our skin. So sometimes you can see the bone. So the part of the skin, the fat, the muscles, and will be burned. No? Symptoms include the burned area appears gray-white, cherry red, or black. There is no initial edema or pain since nerve endings are destroyed. Okay, so in other words, if this is now the degree of the burns, and it is expected that the nerves are burnt out, then you cannot feel any painful feeling. So in other words, damage the nerves that will transmit the information to your brain might be or had been damaged, no? So you cannot sense any painful feeling. Okay, what to do? Usually, not necessary to apply cold to areas of third degree. So never mind applying cold, apply cold water or whatsoever, no? Because anyway, you cannot feel the pain, no? Do not apply ointments. Okay. Do not apply ointments in the burned areas, no? Apply only sterile, non-stick dressings. Okay, as much as possible, no? Do not use plastic. Okay, so checks for ABC again. Okay, so most of the time, try to check for these ABCs, no? Treat for the shock if the victim is have this feeling of shock, then get the medical help or assistance. Okay, so burn injuries can be classified as follows. We have this thermal or heat burns. Okay, of course, caused by flames, caused by hot objects or flammable vapor that ignites or steam or hot liquid. Okay, so that is the thermal burns or heat. What to do for this thermal burns? Stop the burning first. That is the first thing that we're going to do. Stop the burning. Remove victim from the burned source. If open flame, smother with blanket and then coat or similar item, no? Or have the victim rolled on ground. Okay. So use the this blanket, use a coat if that victim is still burning, or okay, have the victim roll on the ground. Okay, determine the depth of the burn. Okay, that is the next thing that you're going to do. So that we'll be able to determine it is either first degree, second degree, or third degree burns. Okay, so let's continue to the chemical burns. Okay, the result of a caustic or corrosive substance touching the skin caused by acids, alkalis, or organic compounds. Okay, so acids, maybe example is a battery, no? Battery solution for these automotive batteries, no? Or for alkalis, So alkalized, so we have this drain cleaners after more extensive or organic compounds, and it is any oil products, okay, that may cause to burning. Okay, so what to do? Remove the chemical by flushing the area with water. Okay, so look for a flowing water, then try to remove the chemical by this flowing water. No? Brush dry powder chemicals from the skin, then before flushing. Take precautions to protect yourself from exposure to the chemical. Okay, of course, if you are the one applying the first aid, then of course you have to protect also yourself. No? Remove the victim's contaminated clothing and jewelry while flushing with water. Okay. Then flush for 20 minutes all chemical burns. Okay, including your skin and your eyes. Okay, cover the burned area with a dry sterile dressing and then seek medical attention. Let's proceed with this electrical burns, no? Okay. So electrical burns, of course, this is cause here is electricity. So a mild electrical shock can cause serious internal injuries. That sometimes we will just say, oh, okay, it's okay for me. It is just a little amount of electricity. Okay, of course, it might cause internal injuries. Okay, serious internal injuries later. So you have to let the doctor examine you, no, as soon as possible. There are three types of electrical injuries. Number one is thermal burn, that is by flame, and the arc burn, okay, it is due to flash, okay, and then through electricity injury, that is contact, no, direct contact to the electricity. Okay, so what is thermal burn? Objects in direct contact with the skin are ignited by electrical current. Okay, so thermal burn yan. Mostly caused by flames produced by the electrical current and not by the passage of the electrical current arc or arc. So arc burn occurs when electricity jumps or arcs from one spot to another. So especially if the electricity is bigger, the amount of the electricity is higher, then it will result to arc, no, or flash. Okay, so through electrical injury, so of course when an electric circuit thoroughly passes through the body, so through electrical injury. Okay, what to do for this electrical burns? Make sure the scene is safe. Number two, or to determine whether it is safe or not, then you have to check if the outlet, if the an appliance or the appliances are unplugged, no, or disconnect or turn off the power as much as possible. So if that is impossible, call the power company or EMS for help. Of course, only the power company, the lineman, no, can cut the line, the electricity of our building, no. Do not contact with high voltage wire. Consider all wires live. Do not handle down the lines. Do not come in contact with person if he or she is electrically if the electrical source is live. Okay, so those are some things that you're going to do as we perform first aid to the victim. Check for the ABC. Again, airway, breathing, circulation. If the victim feel, check for any spinal injury or treat the victim more shock by elevating the legs of 8 to 12 inches. No? We have next accident that might happen, no? Choking. Okay, what is it? Obstruction in the airway. Okay, so you will feel very hard in breathing because the airway is obstructed. Okay, so we have these general precautions. If someone is coughing, leave the person alone. Do not perform the Heimlich maneuver. No, anyway, we know already what is Heimlich maneuver. No, so keep eyes on that person. Ask the person if he or she needs help. Okay, so that is for choking, no? So we have some signs and symptoms. So persons is not able to breathe or talk due to this obstruction. Choking sign given, distress and panic. Okay, hands wrap around the neck is universal sign for choking. So if you are going to wrap our hands in our neck, then that is a sign that that person experienced. What to do if you observe that there is somebody experience choke or choking? Perform Heimlich maneuver if properly trained. So if you are properly trained to perform this Heimlich maneuver, then try to perform immediately to open the airway. No, conscious victim approach from behind and wrap arms around the victim waist. Okay, so ito po, it is illustrated here, no? Then next, place one of fist just above the victim's navel. Okay, and then the thumb side against that abdomen. Second hand over the fist, then pressed into the victim's abdomen with one upward thrust. No? So repeat thrust if necessary, and then try to tap the of the obstruction with that with swift thrust in and up. Okay, so continue until the obstruction is relieved or victim collapses. Have someone call for help, then always stay calm. Okay, so always stay calm. Okay, so what we're going to do if the victim is unconscious, or victim of this choking is unconscious, ask someone to call for medical help, lower victim to floor on back or left side and perform Heimlich maneuver. Okay, so even though the victim is already lying, then you can perform Heimlich maneuver. So open airway with tongue, jaw left, okay? Lock inside mouth. If you can say anything, do not do a finger sweep. Okay, finger sweep, no? So try to give two full rescue breaths if this does not or do not go on. Just reposition the head and give another breath. No? Perform abdominal thrusts, then continue until successful for help or help arrives. Okay, so that's it. Then let us now discuss fractures. There are two categories of fractures: the closed or simple fracture, or the open or the compound fracture. If the skin is intact and no wound exists everywhere near the fracture site, then it is called the closed or simple fracture. Then, or the skin over the fracture has been damaged or broken because of the fracture, then they will may result from bone protruding through the skin. Okay, the bone may not always be visible in the wound. So, what to look for this fracture? Tenderness to touch, swelling, deformities may occur when bones are broken, causing an abdominal shift. Open wounds break the skin, dating sensation caused by broken bones rather rubbing together. No? Okay, so loss of use. So that is one of the that will result so that the victim might feel. Okay, additional signs and symptoms includes for this fracture. The history of the injury can lead to suspect a fracture whenever a science accident has happened. The victim may have heard or felt the bone snap. Okay. So next is we have this heart attack. Then what is this heart attack all about? Usually that happens when one of the coronary arteries is blocked by an obstruction or a spasm. Okay, so internally we have this spasm, then it may block the flow of the air to enter in the coronary arteries. So signs and symptoms of a heart attack include pressure in chest. So felt pressure here in your abdomen or your chest. Okay. Fullness, squeezing, or pain that lasts more than a few minutes or that goes only and comes back. That is some, or those are some of the symptoms that you might observe for the victim. No, pain spreading to the shoulders, necks, or arms. Okay, chest discomfort with lightedness. Okay, lightheadedness. No, so painting, sweating, and nausea or shortness of breath. So if heart attack will happen, then what to do? Call emergency medical services or EMS, or get to the nearest hospital emergency department with 24-hour cardiac care. Okay, monitor victim's condition, help the victim to the last painful position, least painful position, usually sitting with legs or bent at the knees. Loosen clothing around the neck, okay, and midriff. No? Determine if the victim is known to have coronary heart disease and is using nitroglycerin. So try to check if the victim is experiencing coronary heart diseases. No? Then if the victim is unresponsive, check ABC and start CPR if needed. Okay, so if you believe that the victim don't have any companion, then try to directly apply what we call as first aid. No. So for open wounds, we have this brain and the skin surface that results to external bleeding and may allow bacteria to enter the body. So that is what we are going to prevent. No? So we have this abrasion, that is for open wound. The top layer of skin is removed with little or low blood loose, no? Or laceration, a cut skin with gauge, okay, or gag, or jug, no? Irregularities, edges, and caused by a forceful tearing away of skin tissue. Incisions, smooth aids and resemble a surgical paper out. Okay. So next, we have this open wounds, no, for punctures. Okay, for punctures. So this is the illustration of punctures, no, or puncture. So deep arrow wounds such as swab wound from a nail or a knife in the skin and underlying organs. So this is what we call as punctures. We have also the avulsion. Flap of skin and torn loose and is either hanging from the body or completely removed. Amputation, no? We have this amputation. Cutting or tearing off of a body part such as finger, toe, hand, foot, and arm or leg. Okay, so that is amputation or separation of any part of the body to correct the problem of these wounds, no? Okay, so next, what to do, no? So of course, try to wear gloves and expose wound. Okay, expose the wound and control bleeding or clean wounds, no? So to prevent infection, this is you have to clean wounds. Wash shallow, gently with soap and water. Wash from the center out, irrigate with water. Okay, this is the things that we are going to do if we have these wounds, no? So if we have these severe wounds, clean only after bleeding has stopped. So do first stopping the bleeding, and then do the do these things first aid by applying the procedure. So severe wound, clean only after bleeding has stopped, no? So you should have to clean. Okay. Wounds care. How to care the wound. Remove small objects that do not flush out by irrigation with sterile tweezers, no? With sterile tweezers. If bleed restarts, apply direct pressure. Okay. Use roller bandages or tape dressing to the body. So next is keep dressings dry and clean. Change the dressing daily or more often if it gets well or dirty. So try to change the dressing or whatever uh, in our households. No. Okay, so we have this remove small objects that do not flush out by irrigation. Okay. So we have for the next slide signs of wound infection. Okay, so if you cannot protect the wound, then it might uh, it might react with the infections, no? So swelling and redness around the wound, sensation of warmth, then throbbing pain, then fever or chills, swallowing, limp moods, and red streaks. So what is this red streaks? Tetanus, low, lockjaw should receive injection in or within 72 hours. Okay. So next we have let's discuss dressings and bandage, no? So the purpose of dressing is to control bleeding, prevent infections and contamination. Then absorb blood and liquid or fluid drainage. Protect the wound from further injury. Okay, so it's very clear now that try to use this dressing to protect the wound. Okay, what to do? Always wear gloves. Use a dressing large enough to extend beyond the wound's edges. Then cover the dressing with bandage or bandages. Bandage can be used too. First, hold the dressing in a place over an open wound. Apply direct pressure over a dressing to control bleeding. Prevent or reduce swelling, provide support and stability of an extreme or joint or damage. Bandage should be clean but need to be sterile. Okay, so we have to sterile our equipment and facilities. Now, what to do? Control the bleeding. Treat the victim of for shock. Recover the amputated part of the whatever possible. Take it with the victim. Okay, wrap the amputated part with a dry, sterile cloth or other clean cloth. No, put the wrapped amputated part in a plastic bag or other waterproof container, and then keep the bag or container with the wrap part on a bed of ice. No? Seek medical attention once again. So that is very important. Next, we have this checking of spinal injuries. Okay, so spinal injuries, head injuries may indicate that there are spinal or possible spinal injuries. It may have been moved suddenly in one or more directions, damaging the spine. Of course, what to look for? General signs of symptoms. Okay, so we have painful movement of the arms or legs, painful movement of the, numbness, tingling, weakness, or burning sensation in the arms or legs. Okay, next, loss of bowel or bladder control, paralysis of the arms or legs, then deformity at the looking angle of the victim's head and neck. Let's try to discuss things to do. No, so first again, stabilize the victim against any movement. Checks ABCs, or if it or he is not, he or she is not responding or responsive, then we have to check this one. No? Look for cuts, bruises, and deformities. Okay, and then test responsive by pinching the victim's hand and bare foot. No, if no reaction, I assume the victim may have spinal damage. So let's continue here. Responsive victim. If the victim is responsive, upper extremity checks. Okay, so victim wiggles fingers, victim feels rescuer efficiency fingers, victims squeeze rescuer's hand. Okay, for lower extremity checks, now victim wiggles toes, victim feels, however, squeeze toes, and then victim poses foot against the rescuer's hand. Okay, so let's proceed to stroke. So, or it is a brain attack, no? So, what is stroke? Tissue damage to area of the body due to responsive or disruption, above the brain due to disruption in the blood supply, depriving that area of the brain of oxygen. So, this is, for the picture here, this is the part of the oxygen that might experience problem, no, in circulating or circulation of that oxygen. Okay, signs and symptoms of stroke or brain attack. Signs and symptoms of stroke: weakness of numbness or numbness of the face, arms, or legs. Okay, usually one side of the body. Okay, so blurred or decreased vision, especially in one eye. Problem speaking of understanding. So problem speaking or understanding unexplained severe headaches, dizziness, unsteadiness, and of course the cell sudden pull. Okay, next we have this bites and stings. Okay, this is of course not all mammals or insects will bite, no. Sometimes it will sting. So insect stings and bites, then we have to determine the venue or what to look for. No? Check the sitting site to see it if a stinger and the venom sac are embedded in the skin. Bees are the only stinging insects that leave their stingers and venom sacs behind. Scrape the stinger and venom, then suck between with hard objects such as a long nail, fingernail, credit card, selector, etc., and or a knife, no, knife blade. Reactions generally localized pain, itching, and swelling. Okay, what to do? Okay, ask the victim if he or she has had a reaction before. Wash the sting site and soap and water to prevent infection, and then apply an ice pack over the sting site to allow absorption of the venom and relieve pain. Okay, because bee venom is accident, a paste made of baking should medical attention. Okay. So we have this another tick bites. Okay. So I think you know what is a tick, no? So we have this what we call as tick bite. Tick can remain embedded for days without the victims realizing it, no? So try to check your parts sa body, no? Symptoms usually begin 3 to 15 days. Okay, after a tick bites. Okay. So, what to do? The best way to remove a tick is with pointed tweezers. Grab as closely to the skin as possible and pull straight back using steady but gentle force. Wash the bite or site with soap and water. Apply rubbing alcohol and to further disinfect the area. Apply an ice pick to reduce pain. Lotion may reduce lift from itching or keep the area cleaned. Continue to watch the bite site for about 1 month or 4 hours. If rash appears, see a physician. Also watch for other signs such as fever, muscles aches, sensitivity to bring light, and paralysis. Okay, that begins with leg weaknesses. Okay. So, now, let us try to summarize what we have discussed. Okay, so our presentation offers with this chain of survival. What is the first aid chain survey? Initial assessment, victim assessment, sequence, and shock or burns. Okay. Or we have this one, the choking, fractures, heart attack, basic first aid for wounds, dressing, and bandages. Amputation, checking for special spinal, checking for spinal injury, stroke, Brian attack, no, or self and stings. Assess also the situation. Ask for the permission to help possible unless person is unconscious. Then use applied consent. Okay, call for help when necessary, and then stabilize the situation before help arrives, and they try to remain calm and do not panic. Okay, class, that's end our discussion with this chapter 7, first aid, the basic first aid. I hope that you learn many things and you learn something with our discussion. And then I will ask you to subscribe my YouTube channel, and then click the notification bell, and you can see the notification of our basic discussion of the basic first aid. Thank you very much. God bless, and keep safe always.
We are one in mission and vision, instilling excellence in electrical profession.